The federal government has been advised to bridge the gaps in health sector through monetary and non-monetary reform incentives to encourage qualified health workers to work in rural areas and as well remain in the country. The Registrar of Nursing and Midwifery Council of Nigeria, Farouk Abubakar, made the call at a dialogue meeting in commemoration of the FCT 2024 World Health Week organized by USAID Health Workforce Management in Abuja on Wednesday. The registrar, who was represented by the head of Department Human Resources, Emmanuel Udomitre, highlighted the challenges faced by health workers in Nigeria, especially in the rural areas, stressing the need for government to implement incentives to encourage health workers to work in underserved communities.
Because most of these workers are migrating to other parts of the world because of better working environment and better remuneration. So if the pay, the salaries given to the healthcare professionals is commensurate with what they're getting outside, most people will prefer to stay. And of course, the salary may not be exactly the same as what is happening outside, but there could also be incentive and motivation in other ways. For instance, in-service training, suitable housing at the rural areas, and security, ensuring that there's security.
Also speaking, the Technical Director of Health Workforce Management for Lake Akeju stressed the need to rejig the country's health sector, particularly the primary healthcare system, saying that improved funding for the health sector would make healthcare delivery accessible and affordable to the people.
Within the health facilities, the work environment for a lot of them is not conducive, particularly those who work in rural communities, primary healthcare centers, health posts. The condition is not conducive, poor infrastructure, not enough materials for them to work with.
And so what we need to do is, one, improve the enrollment into the various schools, so that many more are produced, and then those that are available should be recruited. And I encourage that most government establishments, including private, should also improve their budgetary provision for human resource for health.
It's calling on federal government, everybody to invest in the health sector. If you look at the Abuja Declaration, they say that 50% of the total budget, 15% of the total budget should be set aside for health, whatever. But I can tell you, more especially from FCT, throughout for the past 4 or 5 years, we have never had even 10%.